Proctocolectomies, that is a surgery that is not easy to talk about because the location of where it occurs. Getting your bottom closed up is not an easy subject to bring up or talk about, even with medical professionals. So in today's video, we're going to talk all about proctocolectomies. Hey guys, it's Maggie and I am back today, and in today's video I thought it might be helpful to talk about proctocolectomy surgery again, some tips, some advice, because it's a surgery that I went through about maybe a little over 4 years ago now. The reason I want to talk about it again, even though I've talked quite a bit about it on my channel, is recently I've gotten a lot of Instagram messages and comments asking very specific questions about how to prepare for this surgery. It is one of the, I think, toughest surgeries I've gone through. I think that's pretty much how everyone feels about the procedure. So I want to go really in depth about some advice. Hopefully this is helpful if you are facing this surgery. I know it's scary. It is scary because not only is this a tough surgery to recover from and the incision is hard to heal from, it is making a life commitment to living with some sort of permanent ostomy or internal pouch. There's no going back from it. So, all right, let's get into it. The first piece of advice that I would give you is get in the best physical shape that you possibly can. And isn't that ironic, because you're probably facing the surgery because you're not feeling great. Your lower intestines, your rectum, are giving you a bit of trouble. And when you think about getting physically strong, that usually means, you know, working on your diet, maybe gaining some weight, gaining some muscle. And that's a hard thing to do when your intestines are not behaving. That's sort of the position that I was in facing this surgery. I was doing okay health-wise. Thankfully, you know, my colon, which is what I was getting removed, was not attached to everything else. I'd been living with an ileostomy for so long, but, you know, I wasn't feeling great. I was losing a lot of energy because of that nasty colon and that dying rectum. So the things that I did prior, you know, I didn't overwork myself, but I tried to get some more protein in. I really tried to up the protein, which at the time I was pescatarian, so that was really difficult for me to do. And I really tried to keep myself hydrated, especially in those last few days before surgery. That meant taking in electrolytes, just really trying to up it. Now you will get IV hydration during this period of surgery, but if you go in hydrated and not dehydrated, you're just better off afterwards. The next piece of advice I would give you is figuring out the logistics of surgery. So this might be asking your surgeon or the nurses that work in their office. This might be calling up the hospital to figure out things. So where are you going to park the morning of? If you have a support person with you, where are they going to stay that day? Are they able to stay with you overnight once you have the surgery? Is there any place for them to get food? Things like that. You might also want to ask about where you'll be in the hospital afterwards. The hospital may not know this. I remember how the hospital works. It's basically, you know, hopefully the post-op floor, they have some room, but sometimes you might not be on that floor. So you'll go somewhere else. So get an idea of where you may be located, but don't count on it. The next thing you want to ask about is testing that you might need prior to surgery. For myself, everything happened so quickly. I had a colonoscopy under anesthesia in their surgery operating room because I had a lot of severe stricturing, and my surgeon wanted to see that before making the call. So then after I had that procedure, I think that was October, I had a follow-up appointment with him in December. I want to say this appointment happened like December 7th or something around that time. And I remember going to this post-op appointment, and they had an opening for Friday the 13th of December, which I know, the date is a little scary. They had an opening though, and so they basically sent me from my post-op appointment or my post-colonoscopy appointment up to their lab to get my pre-blood work done to make sure that I was good to go. It was wild. Everything happened so fast, but they very quickly told me all of the testing that I would need done, and I believe it was only blood work. I don't think that they had me do a physical. I'm trying to remember. Usually they do an EKG just to make sure that your heart is okay for surgery, and I don't remember that when that was done, but I believe it was done at some point. The next thing you'll want to ask is how long you might be in the hospital for, and this kind of bridges me into the next section of setting your expectations realistically, and that's just one of the things that you'll want to set your expectations realistically for, is how long you might be in the hospital. For myself, I was in the hospital the exact amount of days that they told me, and you're going to find this crazy, they told me 3 days. So I was there, I believe, 3 nights, and that was it. I went home after. But when it comes to this, there is so much variability with this surgery. There are so many things that can happen, and everybody that I've talked to, all of my friends that have gone through the same procedure, have had differences in how they recovered, or how the surgery was done, or how their incisions look. So I think it's really important to really just be open to what may occur. So in this variability, you know, people get different scars. Mine was done laparoscopically, but of course with this sort of surgery, there is another incision down below that, you know, obviously has to occur, and that's not really laparoscopically done. It's quite large. And with that incision, you know, a lot of things can happen, and I think it's really important, while it is scary to hear, sometimes these incisions on our bottoms do not close correctly. And that was the one thing that I mentally prepared for. I knew that there could be trouble with it. I knew that it could take a really long time to heal, and I also knew there was a possibility that it might not heal, and I may have to go back for another surgery. That was one of the concerns I brought up with my surgeon, and I said, you know, I'm worried about this thing not healing. And he said, you know, we could do a flap surgery where basically, rather than, you know, closing up the hole and everything kind of looking normal except there's no hole, a flap surgery is taking some tissue from one of your cheeks and closing what would have been the anus, kind of closing over it. So we could do that from the start, but I don't foresee you having any issues. Well, I did have issues, but thankfully it was not too crazy. Thankfully, I was able to heal it. It did take about a year, but I was okay with that. You know, it's frustrating to have an open wound for so long and having to manage it for so long, but I would much rather really work hard. I did a lot of wound care frequently, every single day. I did wound care on my bottom incision on my wedding day morning. So that was, my surgery was December 13th of 2019, and our wedding day was October 10th of 2020. So if that gives you an idea, just how much this can take, but it did close. It did eventually close. With this variability, you know, I talked about going home after 3 days. Boy, you need to prepare for how much time it'll truly take you to not just be in the hospital, but also the healing at home, and the time it takes for you to get back 100% to what you were doing before. And that's something I didn't give myself, and I think that's partially why my incision split open. You know, I left my nursing job, my bedside nursing job at the time, because I knew that the 8 weeks that they could give me off was potentially not enough, and I didn't know how long it would take. But I did have another job at the time. I was working with a telehealth company, and we had a conference in, I think it was February. It was right before COVID. It's like end of February, and flying on the plane from Philadelphia to California to like LA area, it's a 6-hour flight. I think that's what did it. And I was obviously active at the conference, walking around a lot. Even though it had been like 6 weeks in surgery, I don't think it was enough time. Also, just, you know, with the difficult wound healing that you may experience, you may have to go back for appointments, and I don't think that's always given as an expectation with your surgeon, at least in my experience and from others I've heard from. When you have issues with your wound, you may need to go back to your surgeon's office. They may need to do different things. One of the things that they do if your healing kind of stalls is they will do a treatment called silver nitrate, and it essentially wakes up the wound. It kind of like injures it essentially to get it back to healing. They may also be really specific about what type of wound products you should be using, and we'll talk about that in a moment. But I had to go back a number of times to get my incision looked at, and it's in an interesting spot. It's on your bottom, so you know there's a certain amount of dignity that you kind of lose. But I was well prepared for that. I knew where the incision was going to be. I knew that people would have to see my bottom, and you know, everybody was professional about it, and it was okay. Also, setting your expectation for pain levels, because they can vary quite a bit. You know, for myself, the pain is what I expected. I had abdominal surgery before. Obviously, the bottom part of it was the most painful and the longest amount of pain that I had. My belly felt a lot better a lot sooner. And also just setting your expectations of what it may feel like long term. This can vary quite a bit between people. For myself, I feel very fortunate in that I don't have any pain. There is no long-standing pain with my bottom. I can ride a bike. I can do all the things that I did prior without anything like nerve pain or you know, I don't know. It honestly doesn't feel different. And the only time that things feel weird, I get like a phantom rectum, is really on my period now. You know, things get a little crampy down there anyway, and that's the only time that I feel like I have to go to the bathroom. That's a feeling you kind of want to expect. A lot of people deal with that phantom rectum feeling of having to go to the bathroom, but like there's no hole down there. How do you go? I have also heard from people that have long-term nerve pain. It's an intense surgery, and I have seen variability on all incisions. You know, some people get numbness, some people don't. Some people get this nerve pain, some people don't. For the most part, I think that's more of a rare side effect from the surgery, but it's something to think about. When thinking about how this incision feels long term, it makes me think of how long it truly took to get back to my regular routines and, you know, everything I did on a daily basis. It takes a while, and it's really important to prepare your home for that. So making sure that, you know, maybe you do some freezer meals, you cook up some freezer meals so they're really easy for you to throw in the oven or throw in the microwave when you get home. Making sure that you have all of your medications filled, or you have somebody who can fill your medications afterwards. That's fantastic. I was really fortunate with that. My husband was with me the whole time, and the pharmacy was actually within the hospital that I had the surgery. So when I was discharged, I went down to the pharmacy to get everything filled, and we left. So I went home with all of my medications needed. That was stuff like, you know, pain medication. I think that was really it, actually. I think it was pain medication. They did send me home. They gave me a prescription of Tylenol. I don't know why. And then they also gave me a prescription for 3 different types of laxatives, which I told them I don't want them and I won't use them. I have an ileostomy that puts out a lot. Like, there's no issue with constipation here, even though I'll be on pain medication, but they gave it to me anyway. Also, just placing the stuff that you'll need in areas that you'll be, you know, so they're within reach when you get home. You're not searching for stuff, pulling it out of the attic or whatever, is really helpful. And with the stuff that you might need, I have a few suggestions of stuff you either might want to purchase or you may already have on hand, but I found personally really helpful. The number one thing that I think anybody getting this surgery should buy ahead of time, I don't believe any hospitals give it to you. I've never heard of that. They didn't give it to me, is a waffle pillow. And I was speaking to a good friend of mine. She is a colorectal nurse practitioner. She's been in the business for a very long time and has seen a lot of patients. I was kind of asking her, what do you think? What should I get? She recommended getting a waffle pillow. They're about $20 on Amazon, and she said blow it up about halfway. And the reason is if you blow it up all the way, it can put a lot of pressure on your bottom, but if you do it halfway, it gives you the ability to kind of like go back and forth, switch cheek to cheek, but keeping the pressure off that central incision. She said, do not get a donut pillow. And that was my automatic thought. I was like, oh yeah, I should get a donut pillow because, you know, that's what it's for, right? It's for like hemorrhoids and stuff. So it's good for the bottom. But apparently sitting on a donut can actually spread the cheeks apart, splitting the incision. So if you can, avoid a donut, get the waffle pillow. Everybody should get one. I brought it everywhere. Anytime I was in the car, I brought it with me. I mean, anytime I was sitting. I remember we went to a friend's house for the Super Bowl, and I brought my waffle pillow. It was like, you know, when's the Super Bowl? February? So it was a couple months after. I was still bringing it. I think I brought it to California, but I didn't use it on the plane because I was embarrassed about it. So I brought a sweatshirt and I sort of moved it cheek to cheek to make it less obvious that I no longer had a hole. This is something you might already have on hand, but a small step ladder, just because if you have a higher up bed, that's really when I used it. If you have a higher up bed, it makes it easier to get in, because when you get this surgery done, you'll really realize how the movement of your legs impacts that area so much. So even just walking up the stairs, I couldn't walk you know, switching my feet on each step. I had to place right foot up on a step and then bring my left foot to it. Then bring my right up and my left. You want to try to keep your legs together as best as possible. And this just made me think of another thing that could be helpful for the ladies out there. The most frustrating thing about this surgery is having to change the bandages on your backside, because it's not the easiest thing to see. So a 𝙗𝙗𝙗𝙗𝙗, yep, a little funnel for when you have to urinate is very useful. I did not use one. I actually had one. Zach gave it out as a gag gift to myself and his mom and his sister for Christmas. I should have used it. What I did was I wound up leaning really far forward on the toilet to try and get the pee to go forward. It didn't really work. It didn't really work all that well. And so pretty much anytime I had to pee, I had to change my incision. One thing I found helpful for when I had to change my bandages was a makeup mirror. And I'm talking about a makeup mirror that sits on a stand that you can swivel, and it has a magnified side and then it's got a regular side. The way that I would change my dressing was sticking that on the toilet. So it was, you know, a little bit higher up. Maybe you could put it on a stepladder. So it was kind of even with my butt, and I would move the mirror so I could see inside. And if I needed to see a little bit closer, I would switch it to the magnified side. And that really helped me get a good look at my incision, to see where there were openings, to see where I needed some wound care products. And I'll talk about that in a second, because I think that's probably the most important thing. But that mirror made such a huge difference. But okay, let's talk about the wound care products. This is something that I always find sort of shocking. You know, when I had ostomy surgery, it was very clear, like, you're going to have to get a supply company to get the products you need. But every time that I've had surgery where a wound has been a little bit more complicated, it's more like you're given the supplies from the hospital when you're inpatient. Like, oh, here's some gauze and here's some sterile Q-tips and good luck, hopefully that's enough. And for me it wasn't, because I had a wound for a year and nobody set me up with a supply company for this stuff. I wound up buying a lot of stuff out of pocket, which is frustrating. Maybe this is something you could talk to your surgeon about if you're really struggling with your incision. But thankfully I had a number of things on hand, just like, I'm a nurse, I don't know, I have stuff just in case. And I had a lot of gauze, thankfully, but gauze was not doing it for me. I really had a wound that, it stalled with healing, so I did get that silver nitrate treatment at least once, I believe, but it was also draining a lot. There was a pocket of fluid, and that is one thing I've heard a lot, especially recently, I don't know why. I've seen a lot of posts on Facebook about people struggling with that incision draining a ton. I don't know why it does. Could be a little abscess in there. I know they did a CT scan on me and they saw a small pocket of fluid, and it just felt like it was constantly draining and it was so annoying. But the thing that really helped with mine was knowing that with any wound, really, you need to have a moist wound bed for good healing. You don't want it to dry out, but you also don't want too much moisture, because that can lead to infections and stuff and really just not be good for healing. So I wanted a wound care product because I was having so much drainage that would pull a lot of that fluid out of the wound as best as possible, but also leave the surface of it slightly moist. That helps the cells grow across. So I had, this is just an aside, many of you guys have told me I should go to WOCN school. Well, I actually did for like one class. I needed my proctocolectomy. That became the priority, so I wound up leaving, and I never finished, but I did do the wound care class. And that one, you know, I'm not certified or anything. I just did the class. I didn't do any testing or whatnot. But I did do the class, so I learned about all the different products available and what they were good for. And so I tried this stuff. I'm sitting here and I can't remember the name of it. So, no, just came to me. Calcium alginate. That's what I use. It's sort of, you can buy it in different shapes and sizes and whatnot, so I would get a roll of it, and it was maybe that thick. I'd cut some very small pieces, and then I would take sterile Q-tips, and I would gently press it into the wound so it could really pull that extra fluid off. And that is, I mean, that did wonders. I also used Meta-Honey, which helped kind of break down some of that dead stuff that needed to go, helped break that down, kept the wound active so it kept healing. And after a while, you know, once I saw that it was getting near to closing, I discontinued the Meta-Honey, just made sure that I kept a little gauze in there in case there was any moisture that was too much. And, you know, after a year, I finally got the dang thing to close. It took a lot of work. All this to say, wound care and the products available, I mean, there is so much out there. But oftentimes in the surgeon's office, like they don't specialize in wounds necessarily. So they're often going to be like, put some gauze in it and there you go. A WOCN, a wound ostomy incontinence nurse, you know, your ostomy nurse oftentimes does a lot of work with wounds. They really specialize with it, and they know the products that work super well for very particular situations. So you might want to get yourself with a WOCN if you're having trouble with this incision. And that kind of brings me to the last thing of services that you might want to look into long term after this. So obviously the WOCN I just mentioned if you're having issues with your wound, or your ostomy, of course. But some other things. You might want to look into physical therapy. If this surgery really takes a toll on you, which it may, and I don't want to skirt around that fact. It is a hard surgery to recover from. It is painful. It changes you. It really does, physically and emotionally. You might want to look into physical therapy. You might want to look into therapy, you know, just to talk about the difficulties of this surgery. But with the physical therapy, they can help kind of get you back to where you were prior, physically, of course. And then in that realm, pelvic floor therapy. And men, please do not tune this out. This surgery can bring about issues that are not often talked about. They weren't talked about, or I wasn't warned prior to mine. That's why I'm very vocal about it now. But there are things that are embarrassing to talk about and ask about. But I was really struggling with some of the issues, and I had to find help for it. I was very vocal about it because I was irritated that I wasn't told. This surgery, because they're taking out an organ that provides a lot of support to the other organs around it, it can change things, and it certainly did with me. The first thing I noticed was I was having excess drainage. Like all of a sudden, a whole bunch would gush out. Didn't matter if I was on my period. It happened all the time. And what I learned was a little pocket had formed in my vagina, in my vaginal wall, where the rectum used to provide its support. So once I went to pelvic floor therapy, my pelvic floor therapist felt this little pocket, and fluid would collect there. So the discharge that you have throughout the month, you know, normal discharge, it was collecting there. And then when it got too full, all comes out. Same thing happens on my period. So I had issues with that. I also had pain with intercourse, something I wasn't warned about. The muscles tend to tighten down there, and so the pelvic floor therapist helped me work those out and calm everything down. That helped immensely. I did some dilators to help loosen things up and just make it a little bit more comfortable. But there are issues with erectile dysfunction after this surgery as well. So pelvic floor therapy can be really wonderful for everybody. I think everybody should go see one. I really do. I think they're fantastic. Something that you might want to look into as well, this is something my pelvic floor therapist worked with me a little bit on, is massage therapy, like scar tissue massage therapy. With my midline incision, she wanted me to work a lot on it. It's numb, like I can't feel my midline incision. It's really weird feeling to me, so that was hard. But she worked it out because she wanted it to soften. So that was super helpful, but this is something you might want to look into as well. And finally, support groups. There is no proctocolectomy specific support group, at least not that I've seen. Maybe I should make one. Maybe I should do that. I don't know. Would that be helpful? Maybe an ostomy and proctocolectomy support group. But one group that I think is really helpful with this is actually on Facebook, so it's not like an in-person thing. It is a private Facebook group where you can post it anonymously if you'd like, but it's private, so it's not going on your Facebook page. It's the Girls with Guts private forum. I believe that's the name. I'll put it down below. I am in a lot of ostomy Facebook groups, but by far in the Girls with Guts group, that is where I've seen the most posts about proctocolectomies. Now I know it's Girls with Guts, so that's why I'm thinking maybe I should make a little private Facebook group or something we could talk about proctocolectomies. I don't know. I'll have to think about that a little bit. But that one I've really seen a lot of good posts, a lot of good questions and advice for. And I've posted, I've shared a little bit on there to answer questions because I've gone through the surgery. But I haven't seen a ton of posts about proctocolectomies specifically in the other ostomy groups. That's not to say there aren't posts, but you might want to join those groups just to ask your questions, because you wouldn't be the only one in that group with it. There are a bunch of ostomy groups on Facebook. I think that's one of the most helpful sites. That's really, honestly, Facebook nowadays. I use it for like the groups. I'm in gardening groups, I'm in a dahlia group, I'm in a zinnia group, I'm in a raised bed garden group, I'm in a winter sowing garden group, I'm in a ton of ostomy pages, Crohn's pages. That's what I really use it for. I look at all the posts, and obviously the garden ones are the ones that I look at the most. It's my favorite. I'm even in a beagle adoption group, which I don't need to be in because I have 4 dogs, but yeah, that's what I think it's the best for, but that's totally aside. It is great for asking your medical questions. Obviously, take medical advice from your surgical team and your doctors, but when you want to ask those lifestyle questions like, how the heck am I supposed to do this after surgery? It is a great way to find information. Alright guys, so if you have any more specific questions about this surgery, I am happy to answer them. I like doing these videos because hopefully I'm reaching more of an audience than the individual messages, and it's a lot to answer the individual messages, but I'm hoping that I am answering most of the questions, but if I don't, please comment them below. There is a fly flying around here. Alright, let's end this video. Thank you so much for watching, and I'll see you in the next. Bye guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel, like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.